Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the HealthcareNOW Radio network. For this episode, my 178th episode, I'm introducing a new format, whereas once a month, I'm going to host a show where I highlight the latest headlines and research covering the latest healthcare trends, as well as strategies. I use this format inside each of my think tank sessions, but just realized that I should be sharing with my broader audiences. And just very excited for this concept. I do a lot of research. I'm sure many of you do. And there are always a couple of headlines that stick out or research reports. And as I dove into this new concept and strategy for this show, I found some really interesting headlines that I certainly wanted to cover. I mean, even quickly, such as more than 60% of consumers interested in data for rewards program. That's near and dear to my heart because in the last year and a half, I've really dug into the insurer world as well as integrating that with the provider world, integrating that with the digital health world, really under one ecosystem, starting off in Georgia. But I've done a lot of research on consumers, how to bring them much more affordable insurance options. And so, and I've known a lot of this now for the past year, just doing my research and rolling it out to the membership. But there's some really neat strategies that I've come across in my research. So that's one of them where I saw, that 60% of consumers interested in data for rewards programs. I certainly see it as accurate, but in my research, again, I came across some other great headlines that I wanted to share, but then I came across a report from a good friend of mine, Paul Keckley, and then Modern Healthcare just launched this on June 3rd. And so I figured we'll take a moment to really dive in. I'm hoping to get some to the other headlines, but I may just do a follow-up show later next week or the week after, because some of these headlines are terrific. They're very ripe for where we are in the maturation of our industry. So again, I would like to cover them, but I got to this Future State of Healthcare Leaders Survey results. And again, it's from a friend of mine, Paul Keckley, and Modern Healthcare. They interviewed 226 healthcare leaders on 14 future state of healthcare scenarios, and then the level of disruption and the impact of the next 2 to 5 year timeframes. So I thought it was pretty fascinating when I dove into it. Again, I was just trying to cover these headlines and go through a lot of good research, but then I came across this, and I felt like this is going to be a good topic for me to discuss because it really touches on everything from strategy, knowing where the healthcare industry is going, where people feel it's going, where disruption can happen, and then also where some of our blind spots come up. Where many of us are very entrenched in what we do every single day, which is great, but then it gives us blind spots. We're not really looking at the broader picture of healthcare and our industry and innovation, technology, digital health, doctors, nurses, just really the human capital aspect of healthcare. And that's actually one of the reasons why a few of us started our think tank, is just because it really brings together people from all different walks of life in healthcare, in technology, innovation, payer market, provider markets, strategy, other members from other think tanks, and other key thought leaders in general. So it was a great concept. And so that's the reason we put the think tank together. And then as I look at future investments or where healthcare is going, I always try to look well outside of my domain. I try to stretch my knowledge, always learn new things. And that's, again, where the concept of this show also came from, is to really pick on some of those aspects, find them, and bring them to you. It's what I would bring to the think tank. It's what I like to bring in my guests. But again, focusing these shows on this broader concept. And I hope you guys like it. Certainly want your feedback. You can use the hashtag ThisJustinRadio on Twitter, and I'll certainly get back to you, and my team will certainly find that as well. So I'm looking forward to this discussion. But we're going to start off with the Future State of Healthcare, this research report by Modern Healthcare and Paul Keckley. But then also I got some other topics. It depends really how much time it takes to go through this report, because it's been pretty fascinating. And again, it integrates back into where healthcare is going, strategically, strategy-wise, consumerism, that base, financial components, federal policies, insurance. So I think it's pretty fascinating from that standpoint. But let's go ahead and dive in. And hope you guys find this as interesting as I did, and I do. So number one, wave one of the research and the likelihood of these coming to fruition. So the majority, 80% of healthcare coverage this is the question, the majority, 80% of healthcare coverage will come from government programs like Medicare, Medicaid, CHIP versus private payers. So 52% found that very likely, 30% found it very unlikely, and 17% were unsure. So, and I want to give you my color, my take on some of this research. And I do see, obviously, that wind shifting, but as you're going to hear also later on, private insurers will continue to exist. And so obviously coming up with a lot of these Medicare for All programs that are being levied out there, I think, and already spoken about, the very interesting concept to keep a very close eye on. And then the next question here, HHS will encourage the integration of health and social services programs and encourage its funding to address social determinants of health. 66% said very likely. Likely or very likely, and only 15% said very unlikely, and 18% were unsure. I think that's completely accurate. I really do see social determinants of health. We had Evelyn Gallego speak at our last think tank, and I feel that is going to be a significant aspect to population health. Now, timing could still be a few years away. There's active programs today. Some people are moving forward with this right now, but I do see this is going to be a longer play over the next 3, 5, 7, 10 years. But again, it's going to be very important, certainly when you bring in the aspects of social determinants of health with precision medicine, and you start to integrate all of this. I believe, are going to be demonstrable strides in providing better care at lower cost over the long term, always stabilizing the rate of growth in our healthcare costs. So I do believe that. The next question here, private insurers will exit the individual insurance market. 26% said very likely, 56% said very unlikely, and 16% said unsure. I'm not sure of that one. I mean, I completely agree that it's very unlikely. I can't believe 26% said very likely that private insurers will exit. It's $1 trillion market. I don't see people leaving $1 trillion markets. However, even with Medicare for All, I don't think that you're going to see the private insurers exit. You may see some changes, obviously, but I don't think you're going to see anybody exit. I'm heavily in that world now. And I'm kind of battling them every day. So I don't see them exiting anytime soon. The FDA, the next question, the FDA will authorize the importation of drugs made in foreign countries. 56% said very likely, 23% said unlikely, and 20% said not sure. I agree with that. I do believe we're going to look extensively at other options to bring down drug prices. So I think this is pretty much on target. The next question, the Department of Justice will set new standards for defining competition in consolidated hospital markets. 56% said likely or very likely, and 16% said unlikely, very unlikely. 26% not sure. That's interesting. Very well could see this. And the reason being is we have a lot of shifting sands in our markets, and you're starting to see, obviously the physicians have really flocked to the larger enterprises, and these enterprises are getting larger in general. So I certainly do see this is an aspect of our marketplace. The next one, the federal government will turn Medicaid into a block grant program. Very interesting concept. 40% said very likely or likely. 30% said not sure or unlikely, and then 29% said not sure. Very interesting. I'm not sure about that one, but I think that's probably pretty much on target. Market pressure. The next question: market pressure and innovation in care delivery will slow annual healthcare spending growth to 1% above GDP versus 2% historical growth. 35% said likely or very likely. 51% said unlikely or very unlikely, and 13% not sure. Interesting. I believe this is there. 51% said unlikely. I'd have to go in that boat. It's going to continue. We need this direction. We need to continue to reduce or at least stabilize the rate of growth in healthcare costs. There's some really great innovations out there in the care delivery market, the innovation market, the payer market. But we got to just keep the pressure on for sure. The next question, the majority of basic primary care will be delivered by advanced practice nurses, nurse practitioners in retail or on-site clinics. 67% said likely or very likely, and 20% said unlikely, and 11% said not sure. This one's interesting because I'm knee-deep in this world right now, but I have doctors providing that care with nurse backups, but I've also re-engineered and rewired the primary care model, at least in Georgia for where we're at. And I just think that you got to be careful with the retail or on-site clinics from a standpoint of as long as they have access to information, the interoperability of data. We don't want more silos created. We certainly want convenient, cost-effective care and high-quality care, but we just don't want to create more silos. It's something we want to be very cautious of in that model. The next question, Congress will pass a Medicare for all plan. 19% said likely or very likely. 57% said unlikely or not likely. And then 23% said not sure. That just comes down to kind of political flavor and political strategy. So I'm not going to touch that one, but we will see for sure. The next one, Congress will impose price controls on drugs. 62% agreed, said likely, 23% unlikely, 14% not sure. I would have to agree with this completely. I think we're going to see a lot more pressure, certainly with the current administration, on price controls for drugs. I don't think it's going to limit innovation. I think we're just going to have to find a way to manage this a little bit better, much better than we are. The next question, Medicare Advantage offered by private insurers and funded by the federal government will be the basis for Medicare for all. Interesting, because it gets into the constructs of how this could come to fruition with the right political forces. 43% said very likely or likely, 27% said unlikely or not likely, and then 27% said not sure. Again, this comes down to kind of the political aspects, but I think that could be an interesting basis. And also I think when you get to the Medicare for all, I think it's very politically charged, but then also I think offering an option if you want to see a Medicare provider and you want to pay for it, then I think that does get very interesting. As long as it's not adding to the federal debt, and you want to offer, if someone wants to purchase a Medicare product and we can truly price it to what we think it's going to be, then I think it's fair competition. Just underwriting it with tax dollars, I think could get a little bit more interesting. But if you do want to offer a Medicare product and someone wants to pay for it, they should be willing. They should be able to buy it. That's my personal opinion. That right, taking the politics out of it. The next question: medical education and its funding will be overhauled to address staffing pressures and changes in clinical innovation. 50% said likely, very likely, 25% unlikely, and 24% said unsure. This one I tend to agree with. I think the 50% is right. We've touched on this one in the most recent think tank as well. And there really does need to be an overhaul. And a lot of people, and a lot of leading thought leaders who are providers, doctors, and leaders in that space feel that we need to update our training protocols, because a lot of our things that aren't going as well as we want them to do, they feel stem from initial training. So I do agree with this, but I'm just passing on other people's thoughts. I don't really have an opinion on that. I just have an opinion on what I was told by some leaders that I respect. The next question, alternative payment programs like accountable care organizations and bundled payments will fully replace fee-for-service as the dominant payment methods for providers. 59% said likely. This is very important when it gets down to shifting your strategy, shifting what you're doing in your health system, and you're creating new care models, or maybe not creating them, but embracing them, figuring out how do we pull them into our community? How do we, keep our doors open, stay profitable, or whatever your hospital model is, but how do we stay successful and be successful with these new models? We've got to keep looking on that. Again, I re-engineered a model here in Georgia that's being quite successful. I'm tackling this kind of head on. So 59% said very likely, 22% said very unlikely, and 18% were unsure. I completely agree with this one. The next and final aspect to this top research component, prices of hospital, physician, and post-acute services will be imposed by federal state regulators. Interesting. Prices of hospital, physician, and post-acute services will be imposed by federal state regulators. 43%, almost 43.9, almost 44% said very likely, 38% said unlikely, and 18% said unsure. That would be a little bit controversial in some ways, but I tend to, probably the split, the way it comes down, 43, 38, and 18, I think is pretty much accurate. But we're going to see a lot more transparency in services, in pricing for sure. Now the key takeaways from the report: high likelihood, primary care delivery. We need to re-engineer that, but obviously a lot more focus on primary care. Health and social services and drug price controls. High unlikelihood, Medicare for all, individual market exit, and spending slowdown. So I completely agree with all of that. The next piece I'm going to dive into here is really on the disruption side. It's kind of interesting. Certainly I'm going to touch on this for just for my innovators out there and certainly my investor crowd, I have a large constituency of health systems, certainly doctors and nurses, other care providers, but then also a lot of innovators and, well, even payers, but then also I have a lot of the market, just the general market that listens to me from all different aspects. And so I think I really want to pull out the investment community as well. So I think touching on some of this would be interesting on private sector changes. So technologies will allow, the question, technologies will allow individuals to customize their health insurance coverage. This was near and dear to my heart because I've done that here in Georgia. 25.4% said there's a high likelihood in disruption in this. 49%, and then 49%, the next 2 years, 49% said there's likely level of disruption in the next 5 years. So again, this section is about disruption. This is really for the investors, the innovator community. But then also, as you care about your community, as your health system, looking out into your market, I do agree with it. I think you're going to see a high likelihood of disruption in the next 5 years. For sure, we need to let individuals customize their health insurance coverage and let technology, innovation, and opportunity and quality, dive into it much deeper as well. So the next component here, private equity will become the primary source for capital for health systems in hospitals. Interesting. So 30% said that's going to happen, the level of disruption in the next 2 years, 41% over the next 5 years. I tend to agree with this. This is really looking at how much is this going to disrupt the next 2 years and how much disruption in the next 5 years. So I think that's something to keep an eye out on as more private equity comes into this market. The next question, physicians will consolidate into national networks and compete with health systems and insurers. 30% said that's going to be a disruption in the next 2 years. 49% said it's going to be a disruption in the next 5 years. So pretty interesting to watch that one. External disruptors will force change in cost, price transparency, and consumerism efforts. So 37% said likely in the next 2 years to disruption, and level of disruption in the next 5 years, 49%. So physicians will, external disruptors will force change in cost, price transparency, and consumerism efforts. Very interesting, because that I think that's going to happen soon. I guess the level of disruption, but I think it's going to happen, soon. It's 39% said the next 2 years, 62% said the next 5 years, but I think it's going to happen sooner. I think that's just really going to be shifting more in the next 2 to 3 years. Next one, smart devices will become central to patient care coordination. 32% said the next 2 years, 50% said the next 5 years. I guess I'm such on the side of consumerism and innovation. I believe that's going to be much sooner than 5 years as well, but we will see. We're flying down. I mean, I guess I manage most of my care on my smart device today, but again, I'm an anomaly for sure, but I think a lot of people that I'm engaging are moving down this path rather quickly. The next question, employers will double down on wellness and lifestyle interventions to improve the effectiveness of their workforce. 15% said the next 2 years, 30% said the next 5 years. So I agree with this. I think we've wanted more out of the employers in this regard. It's certainly part of my offering here in Georgia, but I believe it's still it goes very slow. But hopefully this will change and we'll improve there. Next question, private insurers will develop integrated systems of delivery to compete with hospitals. 33% said the next 2 years, 55% said in the next 5 years. Very interesting, very controversial, but certainly if you're looking for investment or opportunity or thinking about the future, there you go. The scale and scope, the next question, the scale and scope of primary care service will expand to include alternative health, nutrition, dentistry, and behavioral health. 20% said in the next 2 years, 36% said in the next 5 years. I agree with this one. I'm hoping it's sooner. It's already part of my plan here in Georgia, but I certainly think this is something that we need to integrate and we need to put as part of primary care. It's a natural evolution, and it's just it's needed. It's part of care, and I'm hoping it's part of everybody's care in the next couple of years. Next question, increased community-based healthcare delivery will make hospital-based physician residency programs increasingly obsolete. Interesting. 20% said disruption in the next 2 years, 27% in the next 5 years. This one's really not much on the radar screen of too many people. but we'll see. And the last piece here, consumers are taking more control of their healthcare with data from wearable devices. 18% said disruption in the next 2 years, 42% over the next 5 years. I think it's going to be in the next 2 years. They'll certainly be in that early bucket. We are flying in this direction. People are not taking consumerism seriously enough. And that's kind of what, even if we have time, I'm going to jump over this research study that I came across. But I really think that we've got to dive into this consumerism side. We've got to embrace innovation in the right way. But let me go through some of these key takeaways before I wrap up the show. And I do want to talk about this consumerism from two different perspectives. So the takeaways from this is near term, we'll have more transparency. We'll have more insured delivery. That's good. Certainly if they evolve their models. In long term, more transparency. Okay. Insured delivery and smart devices. I believe that smart devices are going to be more near term than long term. But I certainly understand this is a little difference of opinion there. But now I want to move over really quickly because I do want to talk about the consumer interest for data for rewards program that I touched on. This more than 60% of consumers interested in data for rewards program. This is near and dear to my heart, as I mentioned, because we want to offer more incentives to obviously employers, but also individuals to really use their devices and then to help improve their healthcare, but then also better manage their care. So specifically, for example, here in Georgia, we get a $500 deductible credit if you go in and do your health risk assessment, but then also manage your care on a regular basis for even annually, making sure you go in for your annual wellness visit, do your annual blood work. You get financial incentives for that ongoing. So it's just a lot of opportunity here. And this is, I'm going through a lot of the different incentives, but patients care, consumers care. They want these incentives. And so we just got to make sure that they are offered by different payers. And some people are slower, but you certainly want to offer these out there. It makes a big difference. A $500 deductible credit is a big deal for consumers and for patients. So certainly want to move down that path. But I think some people were surprised by this survey of 60% of consumers interested in data for rewards programs. They want to use their data. They're using their smartphones today. And so I think it's just a great opportunity for us to meet innovation and patient care. The next topic here, nearly 90% of hospital execs feel vulnerable to extreme threats like Amazon and CVS. And this goes right back to the heart of consumerism. So I completely agree. They should feel scared just because. Now, whether it's founded, not quite sure. I do believe our communities are starting to take on innovation, but they've got to really look out there and see, what do people want to buy? What are consumers doing? And these are in the Amazons of the world, the CVSs of the world. They are looking at patients as consumers, and they are starting to take a more thoughtful approach there. And so we just got to really look at it. If you're a hospital looking strategically into your community, you just got to make sure that the old adage, it matters what the customer wants to buy, not what you want to sell. And so we just got to make sure that our digital strategies are being rolled out, the customers are being met, these incentives are being used. And some of the best practices from the article that I read was really the importance of expanding virtual access and virtual care, and to utilize digital tools to streamline care and to improve patient engagement and satisfaction. So I completely agree with that. And it's just really looking at the consumer. We've got to look at new care models. We've got to see not only how they affect, but it's time to look past how they affect, because you got to be past that. You got to start implementing these new care models to really keep up, because we are going to start to lose patients out of our communities. And not necessarily that we know that we want to do that, but there certainly will be some disruptors. I consider myself a disruptor, certainly with my health plan here in Georgia. But you really got to look at your model in your community and see how you can provide highest quality care at a fair price, increase access, and certainly convenience for the member, for the patient. So you just got to look out there and see what you can do. So I hope the show went well. We're coming near the end of our time. Went through a lot of data. I understand that, but certainly we'll make this better. We'll make it more smooth as we go on in the coming weeks and months. But I love the stuff. I love to learn. I hope that you like the data. Hope it's portrayed in such a way that's understandable. That is my goal, certainly for these shows. And hopefully I'll get open to all feedback. This Just In Radio on Twitter. I'd love to get your feedback. So thank you for tuning in today. And as always, you can join us each day at 2:30 p.m. Eastern, 11:30 a.m. Pacific on HealthcareNOW Radio. You also can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so I can respond to your comments from the show. If you missed any of this episode or want to hear more, all of my shows are posted on Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. Also, you can check out the websites that we launched at justinbarnes.com. Thanks, everyone. Have a terrific week.